Hello and welcome to Ask the Doctor. I'm your host, Mike Berger, here to answer your questions on pain management and alternative pain management today are Dr. Robert Bolger and Dr. Renaud Rodrigue from the Southwest Pain Group. Southwest's mission is to care for patients who suffer from chronic and acute pain. The Southwest Pain Group is actively involved in the care of patients who suffer with pain issues. Just call the number that you see on the screen. It's 1-888-572-4411. Or you can go to the website, www.southwestpaingroup.com. Gentlemen, welcome to the show. This is going to be interesting today because we're talking about some alternative treatments to different pains. And let's talk a little bit about arthritis. How about that?
We know, Mike, patients frequently want alternatives. They understand about their traditional therapies, but they ask us a lot about what can I do if I don't want to take medications. And believe it or not, there actually are a number of natural therapies. For example, there's an extract of a spice called curcumin. Curcumin is the most active ingredient in turmeric, which is an Indian spice made in curry. It's extremely effective at relieving arthritis. Studies have shown that 40% reductions of pain. Also capsaicin. Capsaicin is an ointment that you can rub on joints, kind of burning, but if you put it on 4 times a day, it can dramatically reduce the incidence of pain from joints.
And most people are familiar with that because it's an over-the-counter application.
Correct.
Correct.
So we want to talk also a little bit about back pain today and headaches. What about back pain and alternative therapies?
Well, that's an open-ended question, but believe it or not, there's actually a lot of great things for back pain. One of my favorite things for patients with back pain is inversion therapy. You don't have to necessarily take a pill or have surgery or have a shot. Inversion therapy can help people with degenerative disc disease quite a bit.
Now, is this the hanging upside down?
That's right. That's right. And you know, I have back trouble, and I use one myself. I recommend a lot of my patients, and it helps significantly. About a 45-degree tilt for about 8 minutes a day.
But there are other devices too where you can lay in a supine on your back position and use a little pump to separate your pelvis from your chest and elongate the spine, stretch ligaments, and get weight off the disc.
And what about headaches?
That's a real exciting topic for us because, you know, my mom had intractable headaches. No one ever did anything for her. So watch her suffer with these terrible headaches, and she'd go to ER here and there, and nothing ever happened, so she quit doing it. And when I first got into pain management, I really took an interest in pain. Bob has as well. We use a lot of different techniques, including infusion therapies, medication management. But the real trick there is to try to prevent a headache. Once, especially migraines. Once a migraine's in full gear, they're very hard to stop. Very hard to stop.
And that's something patients don't know. A lot of times the medications a patient is taking are actually a migraine trigger. You may understand that certain things cause headaches, but sometimes medicines you're taking, for example, your blood pressure medication, your cholesterol medication,
birth control,
birth control pills, right. MSG. I remember when I was in training, I used to get these terrible headaches every Tuesday. I could never figure out why do I get headaches on Tuesdays. And it turned out that the MSG in the rolls that they were putting, the little Chinese rolls or whatever it was killing me. And when I stopped taking MSG, my headaches
suffered from that as well. So, and it's just,
believe me,
debilitating.
There are many, and Renaud said it very well. The most important thing with headache treatment is to try to prevent it. And so there's a lot of natural ways, and one of the best ways is to avoid things that trigger headaches.
Okay, now we've got a lot of things to talk about today, and we want to get right to your phone calls. We're going to start with Marlo from Fort Worth. Marlo, what's your question?
I have anxiety, and a lot of times I look on the web and try to see about like natural, solutions, natural things that I can do about it. Well, will any of these natural things interfere with the prescription medication that I'm taking?
Well, they can, because in fact, it's a known fact that things like St. John's wort and ginkgo biloba, they can actually aggravate or increase the strength of your blood thinner. Medications like Tagamet, other kinds of acid-reducing medicines can actually increase the effect of narcotics. So it's very important. I'm a firm believer in natural therapies, but you do have to know what works with what.
So it's really important also when you go to see your doctor about any problem you may have that may require medication, you need to tell him everything you're taking, whether it's a vitamin supplement or whatever it might be, because there could be a problem with it down the road.
And natural therapies are powerful. You know, the digitalis, it came from a flower, a root, and it's extremely powerful. So they can be very effective.
Okay, yes.
I was going to say, I think a lot of these, the excitement over new natural medications and these things are over the counter now. People are really using a lot of them and using them for different applications, and we're beginning to see this tremendous amount of overlap or interaction between these drugs. So we really, like you said, do have to know what patients are on, make sure there's no toxic interaction.
Now, I'd like to go back for just a moment to arthritis and talk about some of the alternative medicines that people can use to help alleviate that pain. And there are different types of arthritis.
Yes, there are. And but if you, in general, arthritis is simply an inflamed joint. And for example, four or five very common natural alternative therapies is a drug, actually a supplement called SAMe, which stands for S-adenyl-methyltheanine. It's a long name, but
like
the essential element of it is that it's made from natural amino acids. Also, a red seaweed is extremely effective.
Very
it's full of
good.
calcium and magnesium and thought to be very effective. Fish oil is without a doubt, Mike, the #1 thing we use as a natural antiarthritic. It's a powerful anti-inflammatory, and it's been shown in some studies to be as effective as Motrin.
Really?
Absolutely.
Right.
Now, not only is it good for arthritis, but also people with heart trouble, heart problems, take fish oil, keep everything basically lubricated, I guess.
Exactly.
And that's because it isn't just lubrication. That's because fish oil has, as one of its actions, it reduces cytokines. Cytokines, interleukins are these little nasty Freddy Krueger-like substances that go around your body wreaking havoc with your heart blood vessels. But these inflammatory cytokines have far-reaching effects.
Right.
They affect almost every organ system.
I'm so glad I'm doing this show because I'm learning more stuff every day we do it. Let's get to our website now for our first website question. Debbie in Plano wants to know, I read that in the paper that taking vitamins and natural medicines could be dangerous. Is there any truth to this?
There is some truth in the sense that you do need to know what you're taking. If you take dramatic doses of vitamin E or vitamin A, theoretically you could harm yourself. But in fact, if you take the recommended doses of medications or other supplements rather, there's very little risk and the benefits could be significant.
That brings up in my mind a good question because some people say, well, I'm getting a cold, so I'll take a couple thousand units of vitamin C instead of one. Smart, good thing to do.
That was Linus Pauling. He won a Nobel Prize for that. And I think a lot of that data has been refuted. And people tend to overshoot with the doses. And I think you stay within FDA guidelines, you don't need any more. It's like filling a glass past full.
Okay. Peter in DeSoto wants to know, I fell and hurt my neck about 5 years ago, and it's hurt ever since. And my doctor always tells me that there's really nothing they can do. Is that true?
I'll take that one.
Go ahead.
I'll take that one. There's a lot you can do. It's unusual for people to come into our clinic and we tell them and turn them away. We just can't help you. There's almost always something you can do. And we're very conservative guys. We like to start with the simple stuff first. Maybe some traction, inversion table, or home devices, therapy, biomechanics, things you do at home, or maybe your workstation, ergonomic.
And we work with chiropractors too. Chiropractic can help people in certain situations.
And then you can move on to other things as you need. But generally, most people, you can be treated pretty simply. And of course, there are people who can't be, and you move on to more intensive intervention.
But there are things you can do. That's the bottom line.
Absolutely.
Okay. We're going to take a short break. We'll be right back in a moment. If you would like to ask a question, you can call the phone number at 1-888-572-4411 or go to the website, www.southwestpaingroup.com. We'll be right back. And welcome back to Ask the Doctor. I'm your host, Mike Berger, here to answer your medical questions on pain management today. Doctors Robert Bulger and Renaud Rodrigue from the Southwest Pain Group. All you have to do is call the number that you see on the screen, very easy, 1-888-572-4411, or you can visit the website at www.southwestpaingroup.com. Now let's start this segment off with our first question, and it comes to us from... I'm sorry, I left out a paragraph there. Question. Yeah. And And welcome back to Ask the Doctor. I'm Mike Berger. Here to answer your medical questions on pain management today, Doctors Robert Bolger and Renaud Rodrigue from the Southwest Pain Group. Just call the number that you see on the screen, 1-888-572-4411, or you can visit the website at www.southwestpaingroup.com. Let's start with a question. What are the advantages of Southwest Pain Group's in-office treatment versus receiving the same treatment at a hospital? Good question.
Well, obviously, if there's more expense, and I think there's two things. Really, it's convenience and expense. We can do the same treatment in our office for many treatments, not all, but many, at significant savings. When you're in a hospital, there's just greater expense, and the patient has a greater copay, versus our office where we can typically get it scheduled more conveniently. And I think a lot of patients actually like coming to our office.
Patients do seem to prefer it simpler.
I would think, too, that with the advances in medicine over the last few years, in-office treatment is really quicker and easier than going to a hospital and wasting a lot of time.
Yeah, you're absolutely right, Mike. You notice that the further we get along with technology and advances that we've seen, that we'll see in the future, are all geared towards keeping people out of the hospital, minimizing hospital stays that they must occur, and being as minimally invasive as possible.
Okay, we've got another caller holding, and we want to get right to that question. John's from Keller. John, what do you have for the doctors today?
Yes, my doctor says I have a bulging disc and I need surgery. Can I try an alternate therapy instead? Do you know what my options are?
Well, you have many options, and if we're going to talk about conservative care, one of my favorite options, again, is an inversion table. But there are other options, too. Believe it or not, exercise, strengthening, diet, lifestyle modifications, because if you're fit, your disc bulge can often go away. And do you want to tell me a little bit about the process of bulge retraction?
Yeah, this is we see this a lot of times. We have people come in, you'll get a scan, you'll see a disc bulge. They go, well, wow, what are we going to do about that? We're going to have to have a surgery on that? Not necessarily. Do a few things, get your core better, lose some weight, exercise, strengthen, and you can re-image these people later and frequently see the bulges retracted completely.
Just for my edification, we're talking about these tables. Are they expensive for people to buy, if that's what you would recommend for therapy?
In fact, a new one costs about $300 on the web, and I use a company called Teeter, but there are other companies, but you can get them used on Craigslist for $150.
Right.
Now, what about, we talk about back pain, what about diet? You mentioned losing weight is a good thing to do. Anything else we can do to help there?
Yes, because the same again, I'm going to bring my favorite friend fish oil here, because the inflammatory process of nerve root irritation and the irritating substances inside the disc itself, they're mediated by the same nasty mediators. And fish oil, again, is tremendously effective. But obviously also just eating a diet that's low in meat, low in inflammatory things, you know, lean meat, fish, vegetables, a Mediterranean diet.
Right.
And stay trim. More weight, more trouble on your back.
And more fish oil.
Yes, absolutely more fish oil.
Okay, we have a question from our website now. Paul in Irving wants to know, my friend goes to a chiropractor for his pain. Does this work?
I'll take that one. I tell you, I like chiropractic care. We work with several chiropractors in the area, and they do really good work. They're trying to realign the spine, teach people good biomechanics, ergonomics at work and at home. And again, more conservative care, the better for the back. It's a complex structure, and we like to see people start with that kind of stuff first, physical therapy, and then move on if they need to. But the chiropractic intervention is very effective.
Well, a lot of times I hear, I know a number of people that have had back problems over the years, and they say, oh, the back is the worst thing you can have a problem with. It never really gets fixed. Any truth in that? Is that
In a sense, it's true that once you have an injury, your body makes modifications, changes in your gait and the structure. You can't make a damaged structure grow back and become young and healthy and new again, but you can improve your ability to deal with it. So that's partially true.
Lisa in Mesquite, she says, I have a friend that had back surgery and it didn't work, and now I'm afraid to have it myself. Why doesn't it always work, or does it ever work? And I guess that kind of comes from the question I just asked.
That's an important question because we get so many patients that ask us about surgery, and it's important to know surgery can work with the right patient. In other words, the right condition or the right situation. And so we're not opposed to surgery, and we work with surgeons every single day. So in the right environment, but it should be the last choice, and I think I've seen many patients had a great result with surgery. So there can be failures, but there can also be good results as well.
And Mike, you know, one of the nice things about living in the Metroplex is we actually are blessed with a plethora of very good surgeons. I was very impressed, even where I trained in Minnesota, a place I thought was a bastion of excellent Western medicine. Sure. The surgeons here in the Metroplex, the caliber surgeons, is phenomenal.
Now, we talked a little bit about diet, and if we had a back problem, what kind of calisthenics or workouts might you recommend to help with back problems?
You know, it's interesting. I was reading a study the other day that yoga is very effective. Now, I was initially a little bit skeptical about it, and I researched a bit more. But things like core strengthening, yoga, again, inversion table, and just staying fit and healthy improves your back.
Yoga and Pilates. But I'll tell you, having done some with my wife, it's pretty hard. Doing a yoga routine is not a walk in the park. But if you can do it and stick with it, you're not going to get in much trouble because it's great for your back.
And he works with his wife. Isn't that nice of him? We're going to take a short break, and we'll be right back, reminding you once again that if you have a question, please feel free to call 1-888-572-4411 or go to the website www.southwestpaingroup.com. We'll be right back. And welcome back to Ask the Doctor. I'm Mike Berger. Here to answer your medical questions on pain management today are Dr. Robert Bolger and Dr. Renaud Rodrigue from the Southwest Pain Group. Just call the number that you see on your screen. It's 1-888-572-4411 or visit their website at www.southwestpaingroup.com. Now, so far, we've talked about a lot of pain management, but what questions should a person ask to ensure that they're getting the right doctor to treat their pain? Gentlemen, it's all yours.
I think first credentialing. You want to make sure your physician is credentialed, that you've got a fellowship-trained, board-certified doctor. And then I think it's a comfort level with your referring doctor. If your family doctor, internist, has a good relationship and knows this doctor's reputation, that's a good start.
Right. And you want your pain doctor to really be attentive and concerned about your case and not treat you like a number. I've been a patient, and I know that when I feel that my doctor cares about me, it's a good feeling, like this person's going to look out for me, going to offer me things that are reasonable. I trust them. We have a good rapport. And I want to have that with my patients. I want them to feel comfortable to ask me anything, and also give me parameters. I'm not going to do this. I will consider this because it's reasonable. And then it's our job to offer things that are reasonable within those parameters.
Very good. We have a question from Mandy in Fort Worth.
I have had back surgery, and evidently I need it again. The doctors that have told me that I need to have it again, that I don't want to have the rods and the pins and the screws and all that put in my back. Is there another answer to that type of surgery?
Well, there is, Mandy, and in fact, this is a very common thing that we see. Many times people who have one surgery may need another surgery, or they're thought to need another surgery because there's progression of their disease. So it really involves taking the whole patient into account. We have to talk to her, look at her lifestyle, what kind of things she's doing, what kind of modifications we make in work, her activity, her weight, nutrition. There may be a lot of ways to get her better, or improved at least, without surgery. Agree? Okay.
Absolutely. In fact, we'd prefer people not have repeat surgeries. The results tend to fall off as you move along. And then after number one, number two, the chance of getting good pain relief after a couple of spine surgeries is pretty low.
Our next question comes from Tara in Dallas, and she wants to ask, how can I keep from becoming addicted to pain medications?
this is a interesting thing because you got to make sure you know what addiction means. Addiction means an inappropriate seeking of medication. So if someone has a real pain condition and they're looking for someone to give them pain meds, that's not addiction. Addiction is inappropriate seeking of medications. You go to different doctors, you're trying to say, I don't get pain doctors from this, meds from this guy, but in fact he does or she does, and you're shopping around. That's addiction. So that's the first thing I want to say. How do you avoid getting addicted? Work with a good pain doctor. Maybe internists can do this to monitor the meds, make sure they're appropriate, make sure that your dose doesn't change too quickly over time so that you don't become too tolerant too quickly, rotate drugs, etc. So there's a lot of techniques to avoid people, keep people
the
from
use of them. Try to use them intermittently. That's one of the biggest things, Mike, is if people would use medicines intermittently, it's much lower risk.
Right.
Okay. We're going to take a short break again, and we'll be right back, so stay with us again. If you have a question, call 1-888-572-4411 or go to the website, www.southwestpaingroup.com. Hi, I'm Mike Berger. Welcome back. With us today, Dr. Robert Bolger and Dr. Renaud Rodrigue. And we're going right to a question. We have a question from Robbie in Saginaw. Go ahead, Robbie.
I have fibromyalgia. Why would my regular medical doctor want to change me from using him for my pain management to a pain management doctor? Thank you.
Yeah, Mike, we hear that a lot. Sadly, in Texas, there are onerous regulations, and doctors are actually afraid to prescribe pain medications for a lot of patients, even fibro patients who richly deserve pain relief. Thankfully, we see a lot of these people. There's a lot of things we offer. And one of the things Bob and I have really become interested in the last few years is compounding medications, creams, and pain medications as well, but creams that we use over the affected sites that are tailored to the patient to help ameliorate their symptoms.
Well, is fibromyalgia something that's kind of new, or do some doctors say, well, maybe it is, maybe it isn't?
You know, it's funny, I've come full circle myself. When I first got into pain management and did my fellowship, I didn't really think it was real because we didn't have any real science behind it. It's just a series of complaints, but people kept saying the same story over and over, and we do indeed find that there are microscopic changes in the muscle. It's a real thing. The trouble is it's hard to treat, and these patients really genuinely suffer, and the problem is it's unmeasurable, but it's always characterized by diffuse pain. It's debilitating at times, and generally these patients have a lot of problems with sleep hygiene.
Okay, now we're kind of wrapping up the show, so I'm kind of curious if there's anything out there that may be kind of on the cutting edge of treatment of different pains.
Well, I think one thing that's cutting edge is that we're finding that by mixing or combining medications that were mild. For example, I have many of my patients who are taking ibuprofen. I'll add fish oil. Or I may have a patient taking a pain pill, a hydrocodone. I'll add fish oil, or add an anti-inflammatory. So we're doing a lot of custom mixing.
Right. And there's new medications coming down the pike all the time, too. And in fact, one of the really interesting things is that medical marijuana is starting to find its way into pain management. Now, there's still a lot of regulation, and it's an interesting area because it's a low side effect medication, but with potential for abuse, obviously. So it's interesting. We're starting to look at it, but there's a lot of regulation as it stands now.
Gentlemen, I want to thank you so much for being with us today. A lot of great information here. I hope you've enjoyed the show as much as I have. I want to thank again Dr. Robert Bolger and Dr. Renaud Rodrigue. They're from the Southwest Pain Group. And if you have any questions that you would like answered, you can still call the phone number at 888-572-4411. And if you can't get through on the phone, keep trying, or go to the website, www.southwestpaingroup.com. I'm Mike Berger. Thank you so much for joining us. We will see you next time.
This program is sponsored by Southwest Pain Group and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.